Hi there everyone, my name is Dr. Victoria. I'm a member of the International Christian Medical Fellowship and I am here today to talk about Alzheimer's disease. We hope this video brings you awareness and brings you a little bit more knowledge about the disease. So let's start. So what is Alzheimer's disease? It's the most common type of dementia, but then you might ask, what is dementia? So dementia is a general term for loss of memory, language, problem solving, and other thinking abilities of the brain, or we call these cognitive functioning. So when it's severe enough to interfere with daily living. So back to Alzheimer's. So Alzheimer is a progressive disease that begins with a mild memory loss, and it can possibly lead to loss of ability to carry out your normal functionings of the day. It seriously affects a person because we all have daily activities that we like to do, and when these are interfered with, it can cause a really big burden onto a person and their family. So Alzheimer's can involve the parts of the brain that control the thoughts, the memory or language, and etc. Pathologically, we say that there's a widespread cortical atrophy in the brain. So this is Alzheimer's disease. I'm going to talk about a little bit about the risk factors with Alzheimer's. So of course, age is the most important risk factor, increasing age, as we tend to see Alzheimer's more in the elderly. And also Down syndrome patients, they are at an increased risk for Alzheimer's, family history, head injuries, or cardiovascular diseases. On the slide, you'll see some examples of risk factors for AD, like family history, as I mentioned, gender, age, lifestyle, environmental toxins, head injuries, and also high blood pressure or high cholesterol levels. Some studies say that a healthier lifestyle, it helps to reduce the risk of Alzheimer's, but as we know currently that there are still so much about the disease that we don't know, but the scientists are working hard to find and figure out more things about it. But this is currently what we have, the data that we have to be able to provide for you guys with the information available. So here is another picture of the environmental risk factors of Alzheimer's, like exercise, air pollution, brain injury, like I said, blood pressure, smoking, and even education. So that was a little bit about the general overview. My next partner will come and talk about the symptoms and the signs of Alzheimer's disease. Thank you.
Hey, good evening, good morning. So my name is Dr. Faustin, and I'm going to be talking about the sign and symptom of Alzheimer's disease. As my colleague who just came before me talk about the definition and overview of Alzheimer's disease, now the question is, how do I know that I have Alzheimer's? Oh, how do I know that somebody that I care for or I care about has Alzheimer's disease? If I get lost somewhere or if I forget things, does that mean that I have Alzheimer's disease? That's the question. So those are the things, like I'm going to lay out the thing that you have to watch out. The first thing first is age. Like when you reach a certain age or when you know somebody who has a certain age, it's mostly after 60. You see somebody who's starting to show sign and symptom that I'm going to talk about, then you need to go find your doctor and check out. First thing first is getting lost in a familiar place. You see somebody driving or walking in the street that they have been walking or driving for years and they manage to get lost. So that really happened. And we have memory loss that will disrupt your daily life. You know, such as repeating questions. Somebody will be like, oh, can you repeat again? What did you say just now? You say this thing to them and ask again, can you repeat again? You know, that. And also, you can find somebody who has the sign and symptom of having trouble paying bill, for example. They forget to pay the bill in the end of the month, and if you call them, they'll be like, well, I thought I did it last month, you know. Those are one of the signs and symptoms as well. And then the familiar tasks such as going to work or going to leisure. Somebody used to play football or basketball or golf. Somehow they forget how to do it, or somehow they lose interest, or shall I say they forget that was the daily routine. Misplacing things, you know, like I usually put my water bottle in let's say in my living room, I somehow end up putting it somewhere else, and I don't know where I put it, you know. And a change in mood, personality, and behavior. Those are all signs and symptoms. It's a cluster of signs and symptoms that we recognize. If you find 2, 3, 4 signs in somebody, maybe it's time to go check it out. Thank you so much. I'm joining you from China, and I am glad to express and talk about the sign and symptom. And I will leave the speech to the person who comes next after me, who's going to tell you about more on this disease of Alzheimer's disease.
Hi, my name is Dr. Eleanor Nanan of the International Christian Medical Fellowship. We're talking about Alzheimer's disease. My colleagues have discussed the overview and definition, signs and symptoms, and I'll be talking about the diagnosing Alzheimer's disease. Alzheimer's is the commonest cause of dementia amongst the aged, and although the risk of Alzheimer's increases with age, it's not a part of the aging process. There is no single definitive test to arrive at a diagnosis. The process is a complex one and it requires a lot of time and patience. For the doctor or physician to arrive at such a diagnosis, they would have to do a thorough or detailed history of the patient, taking into consideration their signs and symptoms. Then we would also want to do a physical examination, particularly the neurological examination, the reflexes and all that, to rule out any condition that may be looking like the Alzheimer's. For the blood work, we would want to do a full blood count to rule out any nutritional deficiencies or infection. Then for the brain imaging, we do the head CT scan or the MRI, and in that we could see shrinkage of the memory centers, and that could lead to the diagnosis of dementia. For further studies, we could also do the PET scan or a spinal tapping. We do all these things to rule out any condition that looks like Alzheimer's. Even depression could present as such. Thank you for listening, and thank you for listening. Shalom.
Hello, everyone. Thank you for joining us today. And we are excited at ICMFEL. This month, we want to talk about Alzheimer's disease. My colleagues started with the overview and definition of what Alzheimer's disease is, and also the risk factors, and so on. Also talk about the signs and symptoms. So basically, I want to just add my voice to the many things to say about the treatment and prevention. So basically, Alzheimer's disease that we heard from the overview is a neurological disease, and so most of the time, currently there is not a permanent cure. So what is done most of the time for patients like that is more like symptomatic treatment, and so patients suffering from Alzheimer's disease, when they develop symptoms, there are different stages. They have the preclinical and then the clinical and the severe, the moderate, the mild, moderate, and severe. So most of them, they will develop depression, they will develop the neurological symptoms. So most of the times they will be placed on antidepressants medications if the person developed that kind of symptoms. They have something related to Parkinson. They will be put anti-Parkinson agents, beta blocker, anti-epileptic drugs. If they start having seizure, they'll also be placed on neuroleptic medications. So most of the treatment is kind of related to symptoms. So it's more like symptomatic treatment instead of curable treatment. For prevention, right now, the there is now clear research as to what is the clear prevention for Alzheimer's disease. But yes, it's a vast exercise and cardiorespiratory fitness and good diet would be a good starting point for prevention. So thank you for following us. We're hoping that this month we will have a specialist neurologist to be able to come on our show and be able to discuss Alzheimer's disease. Until then, we want to say have a great time and see you during our next talk show. And we hope that you keep safe and keep healthy. God bless you, and we love you from the International Christian Medical Fellowship.